Did you know that 1 in 3 seniors over 50 miss the signs of a heart attack? It's not always chest pain. In fact, some of the most common symptoms might surprise you. In this video, we'll reveal the silent symptoms that could save your life. You'll learn how to spot these sneaky signs and what to do if you're alone when they strike. Don't let a heart attack catch you off guard. This information could be the difference between life and death. But before I continue, please consider liking this video and subscribing to our channel. We appreciate your support. Now let's get back into it. Have you ever felt short of breath while climbing stairs and thought, I'm just out of shape? Well, you might want to think again. For seniors, heart attacks don't always come with that classic chest pain we all expect. Instead, many older adults experience symptoms that are much harder to spot. Here's a shocking fact. 1 in 3 seniors over 50 miss the signs of a heart attack. Why? Because these sneaky symptoms often look like normal aging issues. You might feel really tired and think you just had a busy day, or maybe your arm aches and you figure it's just a strain. Even feeling dizzy could seem like no big deal. Dr. Christopher Granger, a top heart doctor, says that feeling weak, sick to your stomach, or just off can be signs of a heart attack in older adults. And get this, you might not even have any chest pain at all. So what should you look out for? Pay attention to unusual tiredness that doesn't go away when you rest, mild pain in your upper body, including your arms, back, or jaw, sudden dizziness, and trouble breathing during normal activities. Here's an important tip. Trust your gut. Dr. Sean A. Gregory, a heart doctor at Vanderbilt, says many people who've had heart attacks remember feeling like something wasn't quite right. As we get older, our hearts change shape and work differently. This can make it harder to spot the signs of a heart attack. Understanding these changes could help you catch a heart attack early. In the next part, we'll talk more about how our hearts change as we age and why it is so important to know about these subtle symptoms. Did you know your heart changes shape as you get older? It's true. Our hearts go through some pretty interesting changes as we age. These changes can really affect how our hearts work and handle stress. Let's start with the basics. As you get older, your heart usually gets bigger and heavier. But here's the thing, it's not getting stronger. The heart walls often get thicker, which makes the heart stiffer and not as good at pumping blood. This can lead to some surprising effects when it comes to heart attacks. Think of a young heart like a strong, stretchy rubber band. When there's a blockage, it reacts quickly and causes intense pain. But an older heart, it's more like an old leather belt. It's not as flexible and doesn't react as strongly to blockages. That's why many older people might not feel that classic crushing chest pain during a heart attack. As we age, our arteries get less flexible too. This means the heart doesn't respond to blockages the same way. So while a 30-year-old might feel like there's an elephant on their chest during a heart attack, a 70-year-old might just feel a bit more tired than usual. Dr. Gregory has something important to say about this. He says many people having a heart attack might call it discomfort instead of pain. This small difference in how we describe what we're feeling can lead to mix-ups and delays in getting help. So why are heart attacks so different in older adults? It's because of these age-related changes. The stiffer heart and less flexible arteries work together to create symptoms that are easy to miss. That's why it's so important for older people to know about these changes and take any unusual feelings seriously. Now that we know why symptoms can be so different in older adults, let's talk about something just as important: time. When it comes to heart attacks, every minute matters, and knowing when to act can make all the difference. Imagine you're home alone and suddenly feel unusually tired and a bit sick to your stomach. What would you do? Many of us might think it's just a passing bug and ignore it. But with heart attacks, every minute matters. That's why doctors talk about the golden hour. The golden hour is crucial in heart attack treatment. It's that important time right after symptoms start when getting help can really make a difference. It's all about saving your heart muscle. The longer you wait, the more damage your heart can suffer. This is especially true for older folks. Our aging hearts are already working harder and can't recover as easily from damage. Here's something to think about. People who get help within the first hour after a heart attack do much better. Quick action can really boost your chances of survival and reduce long-term heart damage. That's why Dr. Christopher Granger, a top heart doctor, says calling 911 right away is so important. Paramedics can start helping you even before you get to the hospital. So, what happens to your heart during a heart attack? Think of your heart muscle like a plant without water. At first, the damage is small, but as time goes on, more of your heart muscle starts to die. After a few hours, the damage can be really bad and impossible to fix. How fast should you act if you think you're having a heart attack? Right away. Don't wait to see if you feel better. Don't try to tough it out. As soon as you feel something's wrong, call for help. It's always better to be safe when it comes to your heart. And if you're wondering, what if I'm not sure it's a heart attack? That's a good question, and it's important to know what to do when you're not sure what's happening. You're alone when suddenly you feel tired and your arm hurts a bit. Could it be a heart attack? Knowing what to do right now can save your life. The most important thing is to call 911 right away. Don't wait to see if you feel better or try to drive yourself to the hospital. These mistakes could be dangerous. Emergency services can start helping you immediately. After you call for help, do a few quick things. If you can, open your front door. This helps the emergency team get to you faster. Then, sit or lie down somewhere comfortable. Don't move around too much as it could make things worse. Just stay calm and rest. Take slow, deep breaths to keep your heart rate steady. Every minute matters during a heart attack. These simple steps give you the best chance of getting through it. Many people say they just knew something was wrong when they had heart attack symptoms. If you feel that way, take it seriously. But what if you're not sure it's actually a heart attack? That's a common worry, and it's important to talk about. Let's clear up something that might stop you from getting help when you really need it. True or false, you can't be having a heart attack if you don't have chest pain. The answer might surprise you. It's false. Many people think chest pain is the main sign of a heart attack, but that's not always true, especially for older adults. Here's something shocking. A lot of heart attacks in seniors happen without any chest pain at all. This wrong idea about chest pain being the key symptom can make people wait too long to get help. Seniors might ignore other warning signs, thinking their symptoms aren't serious enough. So, what should you watch out for? Dr. Gregory says many patients describe their discomfort as a vague feeling, not specific pain. You might feel sick to your stomach, lightheaded, or short of breath. Some seniors feel unusually tired or get cold sweats. It's easy to brush these off as just not feeling well, but they could be signs of something serious. Why is it so important to spot these non-chest pain symptoms? Dr. Christopher Granger warns that feeling weak or unwell might be mistaken for normal aging instead of a heart attack. This mix-up can lead to dangerous delays in getting help. Remember, with heart attacks, every minute matters. Is chest pain always there during a heart attack? No way! For many seniors, chest pain might not show up at all. That's why it's crucial to pay attention to any unusual symptoms, even if they don't match what you think a heart attack should feel like. Now that we've cleared up this dangerous myth about chest pain, let's look at another common misconception that could put you at risk. Have you seen that viral post about cough CPR on social media? It claims you can save your own life during a heart attack by coughing forcefully. Sounds amazing, right? Well, I'm about to tell you why this popular advice could actually be dangerous. Cough CPR is supposed to keep you alive during a heart attack by coughing hard at regular intervals. It's become popular online, especially with older folks worried about having a heart attack when they're alone. But here's the truth. Doctors say it's a bad idea. Why? Trying to do cough CPR during a real heart attack can make things worse. Dr. Christopher Granger, a top heart doctor, says coughing can stress your heart more, mess with its rhythm, and even cut down on oxygen getting to your heart muscle. That's the last thing you want when your heart's already in trouble. Big medical groups like the American Heart Association are totally against cough CPR. They say it's not a real way to deal with a heart attack. Doctors don't even do regular CPR on people who are awake. Here's something crazy. This dangerous idea has spread because people share wrong information on social media, thinking they're helping. It shows how fake news can spread online and put lives at risk. The real danger is wasting time trying to do cough CPR instead of calling for help. Every minute matters in a heart attack, so tell your friends and family the truth. Don't share posts about cough CPR. Tell them to call 911 right away if they think they're having a heart attack. So what's this heart attack myth that could be dangerous? It's cough CPR. If you think you're having a heart attack, don't try to cough your way out of it. Call for help immediately. What you can do to help yourself during a heart attack if a cough CPR isn't the answer. Well, there might be something in your medicine cabinet that could actually help. Let's talk about how a simple aspirin could be a real lifesaver. Did you know aspirin could be a lifesaver during a heart attack? It's true, this common medicine might just save your life in an emergency. Let's talk about how aspirin can help when every second matters. Aspirin stops platelets from clumping and slows down blood clot formation. During a heart attack, these clots can block your arteries even more, hurting your heart. Taking aspirin quickly gives your heart a better chance. But remember this, aspirin doesn't replace emergency medical care. Always call 911 first before you even think about taking aspirin. Getting professional help is the most important thing. Here's how to use aspirin if you think you're having a heart attack. The American Heart Association says to chew and swallow 1 325 milligram aspirin or 281 milligram baby aspirin tablets. You need to take it within 30 minutes of when your symptoms started. Time is critical. Why chew the aspirin? It helps your body absorb it faster, which is exactly what you need in an emergency. Every second counts when you're trying to protect your heart. But what if you've been told not to take aspirin? Be careful. If you're on medicines that don't mix well with aspirin, or if a doctor said not to take it because of allergies or other health issues, don't take it. Your safety comes first. Studies show that taking aspirin during a heart attack can really help. It can reduce heart damage and even increase your chances of survival. Pretty amazing for a little pill, right? Just remember, aspirin is only one part of the plan. It's not a cure-all, and it doesn't replace proper medical care. Think of it as a helper alongside the real heroes, the emergency medical professionals who will take care of you. So, how does aspirin help during a heart attack, and when should you take it? It helps by stopping blood clots, and you should take it right after calling 911 if you're not allergic or on conflicting medicines. It's a small step that could make a big difference. But there's one more thing we need to talk about. Many people make a big mistake during a heart attack that wastes precious time. Can you guess what it is? We'll find out in the next part. You're experiencing heart attack symptoms and you're alone. Should you hop in your car and drive yourself to the hospital? It might seem like the quickest way to get help, but it's actually a dangerous mistake. When we're scared and in pain, we often want to take matters into our own hands. You might think you can get to the hospital faster if you drive yourself, but driving during a heart attack could put your life at even greater risk. Here's why. Imagine you're behind the wheel feeling chest pain, shortness of breath, and maybe even dizziness. It's hard to focus on driving when you're in that state, making accidents more likely. Worse, if your condition suddenly gets worse while you're driving, you could pass out and crash, endangering yourself and others on the road. Plus, when you're having a heart attack, every second matters. If you're driving, you're not getting any immediate medical care. Paramedics can start treating you as soon as they arrive. They can give you important medications, keep an eye on your heart, and even perform life-saving procedures if needed. You might be thinking, what if I live far from a hospital and an ambulance would take too long? It's a fair question, but experts still say, don't drive yourself. If you really can't get an ambulance, the Mayo Clinic says having someone else drive you to the nearest hospital should be your last resort. Only drive yourself if there's absolutely no other choice. During a heart attack, you need to stay calm and save your energy. Driving takes focus and effort, which could make your condition worse. Even if you make it to the hospital on your own, you might be in worse shape than if you'd waited for help. So, what's the takeaway? Driving yourself to the hospital during a heart attack is way more dangerous than it's worth. You're putting your life at risk, and maybe other people's lives too. The safest thing to do is call for help and wait for the professionals. They're ready to give you immediate care and get you to the right hospital for your situation. Now that we know why waiting for help is so important during a heart attack, let's clear up one more thing. People often mix up heart attacks with another serious heart problem. Knowing the difference could be crucial in an emergency. Here's a heart attack versus cardiac arrest breakdown that could save a life. Many people mix up these two serious heart problems, but knowing the difference is crucial. Let's start with the basics. A heart attack is like a traffic jam in your heart's arteries. An artery gets blocked, cutting off blood flow to part of the heart. Your heart's still beating, but it's struggling. Cardiac arrest, though, is when your heart's electrical system goes haywire, making it stop beating completely. It's as if your heart suddenly shuts off. The big difference, during a heart attack, you're usually awake and can feel what's happening. But in cardiac arrest, you quickly pass out and need help right away. This means you need to respond differently to each situation. Dr. Gregory says that spotting heart attack signs early might stop a cardiac arrest from happening. That's really important to know. So how can you tell these apart? In a heart attack, the person is awake but might be in pain. In cardiac arrest, they quickly lose consciousness and stop breathing normally. Remember, cardiac arrest is super urgent and needs immediate action. What should you do? If you think someone's having a heart attack, call 911 right away and wait for help. But if it's cardiac arrest, start CPR immediately. Every minute without CPR lowers their chances of survival. We've covered a lot about heart attacks and cardiac arrest. Make sure to share this info with your friends and family. It could be a lifesaver in an emergency. If you found this helpful, like and subscribe for more tips that could save a life. Have you ever wondered how much difference a little knowledge can make? When it comes to heart attacks, it could mean the difference between life and death. We've covered a lot today, from sneaky symptoms to life-saving actions. But here's the key point: your awareness and quick action are your best defense against heart attacks. Let's talk about specific steps you can take right now. First, make an emergency plan. Know which nearby hospitals have cardiac care units and keep important phone numbers close by. Second, learn CPR. It could save a life while waiting for help. Third, make some heart-healthy changes. Eat better, move more, and if you smoke, try to quit. Another important thing you can do is share this information with your family and friends. The more people who know about these hidden symptoms and quick actions, the more lives we can save. And don't forget about your own heart health. Regular checkups are really important for catching problems early. Are you ready to take charge of your heart health? Let us know in the comments. Staying informed and prepared is crucial. Keep this knowledge in mind, and don't wait to act if you think someone's having a heart attack. Your quick thinking could save a life, maybe even your own. So start using these tips today, and let's work together to keep our hearts strong and healthy. Thanks for watching and subscribing to our channel. And remember, the best of your healthy golden years are ahead of you. See you in the next video.